Now, the number of excess deaths registered each week in England and Wales has hit its highest total for nearly 2 years. And the pressure on the NHS is felt very much on the front line, GPs very much in the firing line. Let's get more now on that winter pressure facing the NHS. And we can cross to a GP surgery in Cheshire now. Sky News presenter Neil Patterson is there. Neil, you're doing your podcast there today. Just tell us why you're there and what you're seeing.
Yeah. Well, look, they've let me back on the telly, Jane. Isn't this remarkable? Ahead of Thursday, on which Sky News is going to be doing a very special day of coverage looking into what pretty much clearly is a crisis within the health service. We've travelled here to Wilmslow, to the Wilmslow Medical Centre, in fact, to try and take the temperature at one GP practice, see exactly what has been going on, try and detect where the pressures are and what might possibly be done about them. Here with me, one of the doctors at the practice, Dr. Fari Ahmad. Fari, it's been great to be here, and thank you for giving us such open access. Right now, just in general terms, I mean, how difficult is your job?
Extremely. Really difficult. So I've been a GP now for nearly 20 years, and it's just, you know, it's never been easy, but I think over the past 12, 18 months, it seems to have just got worse and worse and worse.
In what sense?
So, we feel like we're shortchanging our patients, completely in every sense. People getting access to us getting access to tests, to consultants, people who we refer. They're not getting the treatment and they're not getting the input they need. We know that we're sending people in to, because we suspect they've got cancer, but there's so many blocks in the system. By the time it's discovered, it's progressed, treatment's not happening. People who are possibly having heart attacks and strokes are not getting seen in time. People with mental health issues, they're struggling to get access to proper help. We're overwhelmed, the whole system is overwhelmed. I know the ambulances are on strike today, but we've been struggling to get them to come and see our poorly patients. Every single bit of the system seems not to be working. It seems to be broken. I've just had social services on the phone because they've got somebody who's neglecting themselves. They're struggling to cope. There's no flex in the system anymore. We really are teetering. It's not a great place to be.
I mean, you said that you're overwhelmed. I mean, yeah. I'm wondering, just on a personal basis, how you're managing to cope with a workload that has been 100% plus since 2020.
It's hard.
Yeah, I can imagine. What needs to change then? I mean, so many people have so many ideas about what the health service needs, and top of the list it always appears to be is money. I mean, is money the cure-all for this end of the health service at least?
So I think, if you look at funding, I think when we, historically, we've not been funded at, our European equivalents. Then suddenly a lot of money was thrown at the system, not in a very organised or very sensible way. That was dealing with a pandemic. Primary care, so we deal with, easily 90% of the stuff in the healthcare system. We get less than 8% of the funding. So that's something really obvious that needs to change. And I think some of it has got to be that you've got to do the funding and the planning of it long term. People come up with these quick fixes, let's throw some money at this, let's do this. And actually what you need is you almost need the politics out of it. You need sensible adults talking sensibly, rationally. Talk to the people at the front line. I can see solutions. Most of the people there know what the solutions are, and make a long-term plan that's not going to change if somebody else comes in power and says, oh, let's change it all again. We've had so many iterations and changes. We just need to just get on with looking after our patients.
Take the politicians out of healthcare. Good luck with that one, Fari. Indeed, good luck with everything. We've got to say thanks to everyone here at the Wilmslow Medical Centre for the access that they have been giving us. I mean, it's truly eye-opening. I will say this, I mean, you'll have detected it with Fari there. People are, if not burnt out, then, they are certainly fatigued by what they have had to do over the past few years. But every single person I have spoken to has been just as committed as on the first day they started in the job to providing the best quality care. You can find out all about it on the podcast, which will be out Thursday. I'm sure you'll be listening, Jane.
I will. Neil, thanks very much. Always good to listen to on my way home in the car. This is Sky News Today.